Jamaica's health ministry, Christopher Tufton, has made a new health contingency plan as America repositioned their policies on Cuban doctors. Greetings, greetings, and salutations, to all nations. Ladies and gentlemen, you know it's your favorite Jamaica. It's Rastafari Soldier here of Deeproots TV. If you have that, subscribe to the Rastafari channel. Give me a follow. Hit that red subscribe button. Give me a thumbs up. Leave your comment on this one, ladies and gentlemen, as the Health and Wellness Ministry is provocatively developing a contingency plan to address the potential disruption of local healthcare service due to the possibility that U.S. action relatively to using the Cuban health workers. Portfolio Minister Dr. Christopher Tufton made the disclosure while responding to the question on the issue at Thursday's Standing Finance Committee in Parliament. New rules. The new U.S. rule may disadvantageously affect Jamaica hosting Cuban health ministry working, posing a substantial challenge to the country's healthcare system. In addition, the impact of the U.S. government announcement could lead to visa restriction for foreign officials and their families from countries benefiting from Cuba Overseas Medical Mission Program. Now, Tufton told the committee that overall development could possibly impact the island's health system. He noted that Cuban eye care program at St. Joseph's Hospital, for example, performs almost 20 surgical daily, benefiting thousands of Jamaica. This is something that we cannot do without at this time, families and friends, because I'm telling you, we have a lot of people in our country that has glaucoma, that suffers from different kind of eye issue. As we know, Jamaicans usually don't go to the doctor like that, much less to be able to afford, a eye care on a good price. Now, these new rules have Jamaicans stirring on the internet because they're saying, what does America have to do with Jamaica's healthcare? Now, over 400 Cuban medical profession supplements Jamaica's medical staff, primarily in a specialized area, which are significant in shortage in Jamaica, ladies and gentlemen. Now, it would mean that those specialized area, those services would be impacted. The consequences of these suspension or termination of these arrangements would be really, really troubling to Jamaica. Now, Tufton shared that our best arrangement would be to see if we can, train our doctors and our specialists to come to par. Also, we are losing our doctors because of migration. Tufton said to mitigate the potential disruption, he said that the government is to engage in negotiating with Cuba and U.S., led by the Minister of Foreign Affairs and Foreign Trade, with support from the Health Minister. Tufton added that the conversation that are taking place now are attempting to firstly understand the problem a little more, to see exactly what event we can work around and with our bilateral partnership, both Cuba and by extension, the U.S. Furthermore, the Health and Wellness Minister is exploring a contingency plan with countries like Philippines, India, and Nigeria to supplement the island's healthcare system with health profession. Tufton mentioned a memorandum of understanding with Nigeria is being finalized to bring in medical specialists to Jamaica. So while we acknowledge the problem and we would have preferred to have avoided it being a crisis, in the regards becoming, we believe that the relationship with Cuba has been strong and very beneficial, and we would like to preserve it, even if we have to make some adjustment. We are also putting in place contingency plan before we know. We're not necessary contingency plan for this issue, but the need to extend capacity generally, Tufton said. CARICOM Foreign Affairs Minister are to meet to see if there's further clarification with the U.S. government on the development regarding the continued use of Cuban healthcare workers across the region. Now, Jamaicans are good nurse and doctor abroad. So I don't understand why Cubans are willing to work for the Jamaican government and Jamaicans are not willing to work for the Jamaican government. If Cuba can pay their Jamaican, their participant in this program, why Jamaica can't pay them? It's 2025. We need to make sure that we have proper trained doctors and nurses on the island to save Jamaicans' life. It's time now. We should not be depending on other countries to supply our medical staffing when we are supplying other countries' medical staffing. Make it make sense. Mr. Tufton, make it make sense. Ladies and gentlemen, leave your comment on this one. The Health Minister of Jamaica. Yes, Christopher Tufton says that because of change in U.S. policies, they're coming up with a new contingency plan because it appears that America have a problem with Jamaica using Cuban doctors. Me not know why. Ladies and gentlemen, leave your comment on this one. I'm Rastafari Soldier here of Deeproots TV. I'm more fire pan the bag of wire. Fire,